Hello, thank you for joining me as I give you this talk about how to make medical IoT security matter at the executive level. Now, my name is Dr. Saif Abed. I am a medical doctor by background, but I've spent the better part of the decade working as a cybersecurity expert, advising national government agencies, global government agencies, and the private sector extensively, especially large technology companies operating in healthcare. And IoT and OT as a security challenge has emerged in an accelerated way as a significant challenge in healthcare and across the life sciences supply chain as well. But really, when we talk about making IoT security matter at the executive level, it's actually a bigger challenge. It's about making cybersecurity matter at the executive level. And IoT is one of the critical components of that. What we need to remember, though, is how have we got to a point where IoT and OT technologies have become a critical part of the risk factor of healthcare. To do that and to make it engaging at an executive level, it's important to understand what the metrics of success actually are at that level for healthcare organizations. Ultimately, everything we do that we're judged on, if we are leaders of healthcare organizations, is about how we enhance the quality of care that we can provide patients at scale across any service, from the most acute emergency services through to chronic community care. But at the same time, whilst we want to enhance that care quality, we need to do it with the greatest possible efficiency. We want to minimize cost. And of course, depending on the type of health system, how this is achieved is variable, but we want to drive reimbursement into the health system, which can be used to further the growth and advancement of the capabilities of that healthcare organization. And so a key driver for this has been digital transformation. And IoT and OT has become a critical part of that digital transformation as we've sought to go from paper-based systems to wholly digitally based systems, and all the way to using digital systems to guide our clinical and logistical decision making. We're now at a point where many health systems are increasingly fully digitized, or at least their mission critical systems and workflows are fully digitized. We're thinking of medical imaging, we're thinking of diagnostic services, we're thinking about interactions with electronic medical record systems and beyond. And what's important to understand is these systems and workflows are dependent both on extensive network infrastructure, but of course, devices, medical devices, um, estates and facilities related devices. All of these are a key part of driving efficiency, but also enhanced clinical care. But with that digitization, these systems become a single point of failure in their own right. And the way you can look at this is by taking, for example, a lighting system. The failure of a lighting system in a operating theater or in a ward or in a section of a hospital would have a devastating impact clinically of that part of a hospital to fulfill its critical function. You can go to the other end of the spectrum and think about what if the actual medical devices themselves were compromised. If you had a critical bit of diagnostic imaging equipment, such as an MRI machine, no longer functioning due to some type of cyber compromise, you can imagine the impact that will have up and downstream in terms of the clinical workflows dependent on that device. So, this digitization of critical systems, and of course, the role that IoT plays in that, has a significant bearing on my initial slide, which is enhancing quality of care and doing it in the most efficient way possible. But what we also need to understand is that it is not just the technology within a healthcare organization that is increasingly digitized and increasingly interconnected. We've been advancing to a point where delivering effective patient-centered care requires multidisciplinary, multi-organizational, multi-site cooperation. And so you have not only systems that were previously not networked or online, now coming online, you have them sharing data through interconnections across disparate organizations. This is critical for effective patient care, especially since we have an aging population across the world with multiple comorbidities. But at the same time, many of these standards and protocols are completely insecure or misconfigured. And so, with this greater interoperability between healthcare organizations and driving more effective decision making using the ubiquitous nature now of clinical data from said devices, we also have a landscape that's much more easy to compromise and to compromise at scale, which is very concerning and which we have seen a few times over. But if we even then pop to one side the interconnectivity that exists between healthcare organizations within a health system, we need to consider the complexity of the digital supply chain that we now have to factor in too. With every IoT device, there is network infrastructure. There is an interplay with traditional IT in the system. There is the move towards the cloud. There is the interaction with managed service providers. And so you are seeing, just with those few examples, a level of complexity being introduced in terms of the digital supply chain that is crossing borders, that is creating dependencies that previously did not exist, that simply illustrates that the sources of compromise that executive leadership need to consider in terms of their impact on business operations are just escalating in their severity. And this has been happening for some time now. And so when I'm developing a talk that says, how do we make medical IoT security matter at the executive level, really it comes back to a key point that at the executive level, it in a way doesn't matter that it's the IoT devices or their supporting technology that's the source of risk. It's the understanding of what the risk is of any compromise of new technologies, of new ways of working that come from digital transformation. It just so happens that IoT is a core part of this. But what it always boils down to is how does this compromise clinical care and how does it compromise the financial resiliency of a healthcare organization? And what I've illustrated just with these first few slides, I believe, is that the fabric of healthcare through its digital transformation process has become more fragile than ever before. And I believe what I've already illustrated is that the role of IoT, when it's not secured, leaves the space open for compromise that actively leads to care quality being diminished and greater costs being ultimately picked up by healthcare organizations. And these two elements are critical in the boardroom and at the executive management level of every healthcare organization and government agency responsible for healthcare across the world. And so a key question arises. How have we got to this point? Well, there is a diagram that we developed, the AbedGraham group, that we use as part of our consulting activities, but also, frankly, every time I give a talk. We call it the healthcare maturity paradox. What this does is illustrate how healthcare has evolved to become a prime target of cyber attacks and how certain technologies have been drivers of that. Different forms of legislation, regulation, and incentives have meant that healthcare systems have been going on a journey initially to shift from paper to digital workflows for some time. And these incentives have accelerated that. But what happens is, you can see here, the dashed curve representing digital maturity goes up, it hits an inflection point, it really accelerates, then it starts to plateau. But at the same time, security maturity does not pick up at the same rate, because it should not be accepted, but often is, that if you have newer technology, it should be more secure than older technology. When in reality, what's happening is that the risks are simply different. And so, yes, you may get an incremental improvement in your security posture, but without specific investment in cybersecurity, actually, you maintain a significant, if not growing, gap between your level of digital maturity and your level of security maturity. And that gap, which I call the attacker's arbitrage, is what makes a specific sector attractive to attack, a specific health system attractive to attack, or a specific type of technology, we'll say IoT and OT technologies in this case, attractive to attack. After that, it's about whether the incentive exists to conduct the attack, which we know does exist in healthcare from the near daily ransomware attacks that we see, and prior to ransomware really taking off, data breaches. But here you see a fundamental fallacy at work, and that is that digital maturity equates to security maturity, which equates to patient safety, which fundamentally, of course, it does not. I have just illustrated that in this chart. Enhanced adoption of technology, enhanced adoption of innovative technologies, the growth in digital maturity does not equate to security maturity, and therefore it does not equate to greater patient safety. If anything, the gap that then develops between digital and security maturity leads to a compromise potential for patient safety that is that much greater. And so, what does that mean at an executive level? Well, frankly, it means you start to see headlines like this: catastrophic figures in terms of financial losses. Take it at face value that they may or may not be picked up or covered by their insurance providers. These are staggering sums for a health system or service provider to be dealing with because of a ransomware attack. It has been reported by the Department of Health and Human Services in a presentation that I saw last year that, and I'm paraphrasing here to an extent, but the average cost of a ransom from a ransomware attack is around, I believe, the $150,000 mark. But the average cost of recovery is in excess of $1 million from a ransomware attack. And so if you think of the expanded surface area for attack, if you think about the types of devices that are now online and interconnected, then the potential to conduct these types of attacks has grown significantly, if not even exponentially. And you would think that this slide by itself illustrates the concern that may exist for executive management, but it actually develops beyond this. Now, what I'm about to illustrate are extreme cases that are still being, in some instances, litigated, but they give you a sense of how we can go to a more concerning angle on this. And remember, my first slide said about care quality and efficiency. Well, if this slide demonstrates what happens in terms of costs and efficiencies, then this slide highlights what can happen potentially in terms of care quality. You see delays in clinical decision making, delays in access to key data points that lead to potentially delays ultimately in care that can have the worst possible outcome. Again, some of these cases, especially the one affecting the tragic death of a newborn, are being litigated. These are not conclusive, but the headlines by themselves illustrate how cyber attacks are being seen in the context of healthcare now. And this doesn't even account for the number of people who are simply harmed as a consequence of cyber attacks because of delayed clinical decisions, delayed clinical management. And a lot of those are never investigated. The majority aren't. So right now, we're only seeing the extreme cases, but it's the tip of the iceberg in terms of the clinical harm that does occur when critical clinical systems are no longer accessible or critical clinical devices. They all form part of the same workflow that is essential for the delivery of effective healthcare. And let's be clear, the attackers are becoming more sophisticated. And they're becoming more sophisticated in two ways. One is, of course, the volume of attacks has increased, and the business models and the methodologies to conduct attacks at volume have evolved. You just have to look at ransomware as a service and how that can be used to target the wide array of insecure connected medical devices in the world and their supporting infrastructure. But at the same time, attackers understand the importance of clinical urgency. They have a window of opportunity. The greater the clinical risk as a consequence of the attack, the more likely they are to get paid. And so when you look at this, you really have to understand that the role of IoT and OT systems is that they are affecting access to critical clinical systems and devices, or if we take the natural evolution, if it's not availability, if you're tampering with the functionality of these systems, then you lose trust in those systems and their data. And so effectively, it renders it unavailable because you won't use it. The integrity side of the equation is more academic right now, but we've seen some instances of that happening. A water treatment plant in Florida was the target of an integrity attack, and some researchers in Israel have demonstrated the creation of malware that creates fake cancer nodules on medical imaging. So we are seeing some interesting examples of that side of the equation affecting essential systems around IoT and OT. But speaking as a clinician, when you see these critical attacks happening, these are the types of questions I never want to be asking, and I never want a patient to be asking. When will I get my test results? Where will the ambulance go? Will the emergency room be open? Can I run my operating list? Can I prescribe my medications? Can I order tests? Will my chemotherapy session go ahead? These are the types of questions that are devastating to a business. And frankly, those are the outcomes presented starkly at the executive management level that more often than not lead to change, action, and strategic plans being developed. Because here's the thing, as far as I'm concerned, in the work that I've done at all levels, private and public sector, the business case for any type of security, but let's just say in this instance, IoT security, should be based on clinical service impact. And in particular, clinical service impact at scale. At our organization, at the AbedGraham Group, we have a methodology called the COFR approach that we use to do this. This methodology also underpins our security analytics solutions that aim to answer some of these questions. But if I were just to outline the methodology, we subdivide risk and communications about risk under four headings: clinical, organizational, financial, and regulatory risk. Clinical is all about answering the question, what type of harm and how severe will that harm be to an individual patient if a device or its infrastructure that supports it is compromised? Organizational impact is about scale. How many services, how many workflows, how many patients will be affected in terms of the quality and effectiveness of their care that they will receive, again, should a device or particular set of infrastructure be compromised. And then the next two are self-explanatory. The financial impact, cost of recovery, cost of litigation, cost of lost reimbursement. How do we factor those in when you look at the failure of IoT or OT systems? And regulatory, frankly, looks at the level of scrutiny and punishment that an organization will face as a consequence of an attack on these systems, and of course, the reputational harm that comes with it. What's key in all of this, whether it's this methodology or any other, is that to discuss security effectively and to enact change, it has to be done in a multidisciplinary way. It has to be done in a way that means key decision makers with no technical background can engage when it comes to a cybersecurity subject. And IoT is a prime example of this. So when you look at these headings, clinical, organizational, financial, regulatory impacts and outcomes, you immediately see avenues for engaging different types of executive leadership, either just generally or in particular, clinical leadership, operational management, general counsel, financial leadership. There are ways to look at IoT security by understanding how a healthcare organization defines success that allows you to present IoT security as something that's worth investing in, that creates a return on investment that's tangible for the organization. And with that, I'd like to thank you again for your time, and I look forward to your questions later today. Thank you.